Hair transplant, 4,200 grafts, 24 days and no hair shed. Is this normal? I have had no hair shed and look like pictures below. Is this normal? Also, at 21 days, my head was rubbed quite hard. How would I know if it caused damage?
Thank you for your question. You submitted your question with 2 photos, and you stated in your question that you underwent 4,200 grafts and that you are at day 24 and you're concerned about the lack of hair shedding, and you're also concerned about your head being rubbed very significantly at day 21, and you're concerned about damage. Well, I can certainly share with you my perceptions of what you're going through. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed using regenerative medicine technology that evolved from application to hair transplant surgery. And I'll discuss that even further as I discuss more details about your question. So to begin with, the time in which hair sheds is somewhat variable soon after surgery. There is a certain thing called shock loss that is not uncommon, where the hair from the graft will shed, and even native hairs in an area where the graft were placed will also shed. And that can happen in the first couple of months. And the results of a hair transplant, therefore, require just waiting about a year after a transplant. It's not unusual for people to get really concerned because of some shedding a few weeks out, where things can be kind of patchy. So for now, I think you can not be worried that there wasn't shedding, and still be prepared that there may be some shedding in the upcoming weeks. As far as the scalp rubbing is concerned, technically speaking, once a graft is in place for a few days, it actually takes a lot of effort to actually get the graft to be dislodged. In other words, wound healing occurs really in such a manner that if a hair graft is going to survive, it'll survive the hair rubbing. And a lot of times patients are very scared to do anything like wash their hair, and they actually have to come into the office to actually have our staff rub and clean the scalp. Now, when it comes to this type of scenario, we have a lot of experience, whether when we were doing a lot more transplant surgery, we wanted to achieve less shedding, because that can, as I said, it can be very distressing. We wanted to also have better graft outcomes, in other words, the healing and survivability of those grafts. We wanted to see the donor area heal better. And so we used this material called acellular matrix and combined it with platelet-rich plasma. We did find that there was somewhat less shedding after this combination of treatment was done, but we also saw that thinning hairs became thicker. And we've been using this method that we derived over treating so many patients over the past 7 to 8 years who travel from around the world with thinning hair, that we've developed a protocol and system for different classifications of patients. And that factors in age of onset of hair loss, degree of progression, the current age, the other medical procedures such as having a hair transplant, and we've been essentially able to help people in a way that's non-surgical using regenerative medicine technology. Now, this particular aspect of our practice has been leveraged further in helping patients who have had hair transplants done elsewhere. Patients who have undergone hair transplant, like yourself, are frequently scanning the web to learn about ways to optimize hair growth. And a lot of times people come across our information and they come in somewhere between the first and third month after their transplant. And what we've been able to do is actually, in many patients, expedite their healing. We've been able to get them to have regrowth of their grafts sooner than that 1 year point, as well as to expedite the healing process and further allow the regenerative aspects of our technology to help their existing thinning hair. And so there seems to be a certain group of patients, and I'm not saying that this is applicable to you, but there's been a certain group of patients who have been able to benefit from regenerative technology even if it wasn't used at the time of the surgery. And it's just something to learn about, and certainly not something that's required for you to have a successful outcome. So I think that you can certainly, and it's very important, maintain communications with your doctor. These are the questions that everybody who does hair transplant surgery get asked regularly. And I think it's very important for you to maintain this dialogue and do your follow-up visits with your doctor so that the optimal management of your hair, of the healing process of your transplant is maximized. So I hope that was helpful. I wish you the best of luck. Thank you for your question.